Hello to everyone. I can see a few people joining. It's now 2 o'clock p.m. set time, so we might just wait a few more seconds um, to allow two other colleagues and friends and participants to join, if that's all right with everyone. Oh, thank you to whoever sent that thumb up. Also, just to say, while we're waiting for others to join, that if you want to introduce yourselves on the chat, just put your name, your title, the organization you work with, that would be nice. And also, whoever is able to switch on their videos and they want to just be on camera, that's also nice for the presenters to see other smiley faces at the other side, at the other end of the screen, so that you're very, very welcome also to do that. But of course, if your internet is not strong enough or you prefer not to, that's also fine. Right, so I think we should start. Yeah, it's always nice to wait for some colleagues, but also the ones that are here on time and early, they shouldn't actually be penalized and waiting too much. So welcome to everyone. My name is Monica Martinez, and I'm the Primary Prevention Program Manager for the prevention program with Plan US. I'm delighted to be here today. And again, thank you everyone for joining. As you can see on the title, this webinar is on lessons learned, specifically on monitoring and evaluation, the primary prevention framework in two pilot locations. So today we'll specifically be looking at that area of monitoring and evaluation. I was just saying before to the colleagues that joined, for those that recently joined, also just to say that you can introduce yourselves on the chat box that we have. You can put your name, your title, your organization, any greeting, anything that you feel like sharing with us today. Michelle has kindly agreed to be monitoring that chat. So if while the panelists are presenting, you might have any questions, any doubts or any comments, please also feel free to place those there. And then we'll have some time allocated towards the end of the presentation to actually look at those comments, those questions, and have like a plenary and hopefully lively discussion. Next slide, please. Right, so I'm delighted to be here today, surrounded by a great group of professionals. So we have Michelle Banakin, who is the Associate Director for Humanitarian Programs for Plan US. And basically, she's one of the brains that know more about prevention. So we're very, very happy, primary prevention. So we're really, really happy to have her with us today. Also, we're really happy to have Malish Clemens, who is the Field Coordinator for Plan South Sudan, and he's been also like the engine of the piloting of the program in South Sudan. So we're really pleased to have him here to hear all his experiences and reflections on the pilot. And we also have Lomena Albino, who is the meal coordinator also for the Plan South Sudan office, which again has been crucial into working out all the M&E parts of the program. So with that, and then you have me also, that I have also introduced myself already. So with that, I will give the floor to my colleague Michelle for an introduction on the prevention initiative and a brief prevention on the program. So over to you, Michelle.
Great. Thanks, Monica, and good morning, good afternoon, or good evening, everyone. Thanks for joining us today. So just to give you a quick background on the Prevention Initiative, the Prevention Initiative was officially started in January 2020, and prevention was identified as one of the 4 main priorities for the Alliance in their 2021 to 2025 strategy. The goal of the Prevention Initiative is to promote increased understanding and prioritization of efforts to prevent harm to children in humanitarian settings. So seeking to look at how can we prevent harm before it occurs, to complement the work that we are already doing in response. The prevention initiative is co-led by the Alliance and by Plan International and has an advisory group that includes a wide range of actors, including local NGOs, national NGOs, international NGOs, UN agencies, academic institutions, and as of September 2024 includes 33 agencies with 39 members total. So we're really lucky to be supported by a great advisory group that provides important feedback and support on all of our work. Next slide, please. So before we dive into today's webinar, just to do a quick overview for those of you who are only recently joining us in the primary prevention sphere, primary prevention looks at preventing harm before it occurs. So it addresses the root causes of harmful outcomes at a population level, seeking to support all children in a community or population. This is different from secondary prevention, which is something that we are much more familiar with, which is where you are addressing a specific threat or vulnerability. So, for example, supporting a child who is at risk of child labor or a child who is at risk of child marriage. So children who we know are specifically vulnerable to a harmful outcome or a child protection risk. And then there's tertiary prevention, which is where you're seeking to prevent harm from reoccurring. So this is, for example, work that we do in case management for children who have already experienced a harmful outcome, or this could be, include reintegration of demobilized children associated with armed forces and armed groups. So this piece of work is specifically looking at the primary prevention level. So how do we prevent harm before it occurs across an entire population, meaning we're working with all children in a community. To help guide this work, we have developed several key resources. Next slide, please. And kind of the touchstone resource for this initiative is the Primary Prevention Framework for Child Protection and Humanitarian Action, which provides guidance for humanitarian workers on the key actions and considerations to apply when developing, implementing, and evaluating programming to prevent harm to children in humanitarian settings at a population level. So this framework outlines both the 8, soon to be 9 key principles to consider throughout a primary prevention approach throughout each phase of the program cycle, as well as key actions and steps that should be taken within each of the 5 steps of the program management cycle to ensure effective primary prevention efforts. So it's structured based on the program management cycle, going through each of the 5 phases, from preparedness to needs assessment and situational analysis to design and planning, implementation and monitoring, and finally evaluating and learning, with key steps and considerations for each of those phases to ensure that we are taking an approach that ensures prevention of harm before it can occur. So this resource was developed between 2020 and 2022 with the support of the advisory group and in consultation with humanitarian actors at field level. It's supported by a desk review of over, I believe, I can't remember the exact number anymore, but over 200 documents that documented effective approaches to prevent harm across in humanitarian and development contexts, as well as across child protection, GBV, education, health, and other sectors. So this piece of work then led to the next phase of the project, which, next slide, please. Oh, go back one more. Thank you. So as I mentioned, so while this resource was developed in close consultation with our advisory group and with consultations with child protection practitioners at field level, we were not able to actually field test the resource. And so the next step following its release was to field test the resource with additional funding from USAID's Bureau for Humanitarian Assistance. And so the goal of this current project that we have undertaken is to both pilot the prevention framework and incorporate lessons learned from those pilots into a revised version of the framework, but also to develop and test a monitoring and evaluation guide to accompany the primary prevention framework for evidence generation relating to the effectiveness of prevention programming. So really, this was meant to test the usability, the effectiveness, the relevance of this tool, but also to be a really key opportunity for us to pilot a primary prevention approach. And so the way that we did this was through partnering with two of Plan International's country offices, one in South Sudan and one in Niger, to actually pilot the entire framework through each step of the program cycle. So to go through the preparedness phase, to do a needs assessment and situational analysis, to then develop and design a program based off of that needs assessment that would then be implemented, monitored, and evaluated. And so when we talk about the piloting process, it's not just about the activities implemented, but rather the entire the entire program cycle and each phase testing this resource. So as I mentioned, we piloted in South Sudan and in Niger, and in both of those contexts, we ended up designing integrated multi-sectoral programs to address harmful outcomes. So in South Sudan, we were seeking to address child marriage and child labor. The goal of the pilot there was to prevent child marriage and child labor in targeted locations through improving access to livelihoods and quality education. And in the pilot goal for Niger was to prevent child marriage in the Diffa region through strengthening the protective environment. Now we are nearing the end of this of the project, and so I'm going to pass it on to Monica to kind of walk you through the webinars that we've done and where we are now with the project and the goals of this specific learning opportunity. So Monica, back over to you.
Thanks, Michelle. That was a wonderful introduction and a very complete one. So basically, we actually, as she just mentioned, one of the main goals of this, the piloting of the program has been also to learn and to be able to collect and extract as much learning of what has really happening while the implementation, while the piloting process, and to be able to use that to inform the revised version of the framework, and basically to get better and how do we actually do primary prevention programming. So for that, also in terms of disseminating this learning that we are collecting, we are conducting a series of webinars. So we had one in September last year, which was focusing on that initial phase that we were mentioning on preparedness, needs assessment, and design phase, which you can see there in the diagram. It would be corresponding to number 1, 2, and 3. Then early this year in May, we also have another webinar explaining lessons learned that we extracted from the implementation phase, which, as you can see, if you follow the design, it would be 4. Today, we're having webinar number 3 in this series, which is monitoring and evaluation. And you'll see that, well, this one cuts across 2 of the different stages. So number 4 is talking about monitoring, and number 5 is talking about evaluation. But we thought that it would be a much more interesting approach to just bring these 2 together, since they're obviously very related, and have a webinar, that is specifically looking at how those 2 processes are working together in terms of monitoring and evaluating the program. And then, just to say also that the last 2 webinars, you can access the recording, and they should be on the webpage of the Alliance. So if you would like to know a little bit more about that, just please go and find those, and you can watch then, just to complement what we're saying today. And then there would be a final webinar that would be happening early next year, which would be looking at overall reflections and learnings of the whole process of piloting the framework in these 2 countries. Next slide, please. Right, so this one is just, I will go quickly through it, but it's just basically for us to set the objectives of the session today, the ones that we have envisioned. And basically would like to share with you the successes that we have achieved during the program, but also some challenges and some solutions that we managed to find for monitoring the prevention program. We'll also want to discuss the challenges, solutions, and learnings in terms of evaluating the primary prevention program. The learnings and discussions that are happening also today and the ones that will be happening will be informing the revision of the framework, as we just mentioned. So hopefully to make a more robust guidance resource. And then we'll also be sharing tools and guidance. Michelle just spoke about the primary prevention framework, but we also have another bunch of resources that they can also be shared with whomever wants to know more about this topic. Next slide, please. Right, so before we actually move into hearing from our colleagues in South Sudan on how they have actually undertook monitoring and evaluation, the prevention program, I wanted just to share a couple of slides reflecting on some general considerations and particularities when it comes to measuring results for primary prevention programs. So we go to the next slide, please. You can see here this kind of like rudimentary design, but I mean, you see this arrow, how we have like monitoring and evaluating a primary prevention program might not be massively different from the processes and instruments and tools used when monitoring and evaluating a response-centered program, except that it has some specificities and some particularities that I will be sharing with you soon. But for our case, the case of South Sudan that we're looking today, in both of the pilot countries, in Niger too, we did a baseline assessment at the beginning of the program where we set the results level outcome indicators. Then throughout the implementation phase, we were periodically monitoring through various methods that we will also discuss later, like PDMs, observation, monitoring visits, etc. And this phase lasted from around 8 months, from November 2023 to June this year, 2024. And then finally, in July this year, we also conducted the end-light assessment to basically evaluate whether the program has achieved intended objectives and by assessing changes in the result level outcome indicators that we set up ourselves at the beginning. And as I say again, all this revision is part of learning and improving, and it will be informing the addendum for monitoring and evaluation that we are also developing. Next slide, please. So what's unique? What can we say that is unique to measuring or to try monitoring and evaluating prevention? So measuring primary prevention poses unique challenges because it seeks to track the absence of harm, correct? Rather than responding to harm that's already happening. So this is a very key concept. Like typically monitoring and evaluation frameworks are designed to measure the results of something happening. So intervention X leading to outcome Y. However, in prevention efforts, we aim to measure the absence of harmful outcome for children, and this requires a different approach. Ideally, this could be achieved by establishing counterfactual models, which some of you that are good in M&E might know, that would be creating scenarios showing what will have occurred without the actual intervention. For example, to evaluate the prevention of child labor, we could measure what rate of child labor would have been without actually in a population group, without providing that population group with access to quality or affordable education, which is a protected factor against child labor. However, as you would imagine, this poses ethical, logistical, and resource limitations. So creating these robust counterfactual models is not very often very practical, especially in humanitarian contexts. So instead of that, we need to, like even the framework is telling us to resort to the use of proxy indicators. What are proxy indicators? So they're basically indicators that are going to be measuring the decrease in risk factors associated to the harmful outcome that we're trying to prevent, and the improvement of protection factors, again, associated to the harmful. For instance, in the case of child labor, that proxy indicator could be the decrease on dropout rates of children and adolescents in a school age. Why? Because here, a school dropout is a risk factor that can lead to increased likelihood of child labor. Or, for example, another one could be increase a stable and dignifying livelihood capacity for caregivers so that they do not have to resort sending to children to work. So again, in this case, these could be understood as a protected factor preventing the occurrence of child labor. So these type of indicators are the ones that we're going to be using to measuring prevention. And also it's important to note, and we'll see more of these as we move along into the presentation, but also I'll just put here a note into integrated programming, because it's important to highlight that a primary prevention approach, it's almost always going to be integrated in nature and will always include the collaboration, the coordination, and the working together of different sectors, not only child protection, but education, livelihoods, M&E, and other sectors to actually achieve common goals for the protection of children. Next slide, please. So, right, so this slide showing the key actions that are contained in the last phase of the primary prevention framework, which is aiming and evaluating and learning. So as I say, we're talking about evaluating today through evaluating changes in result outcomes at the level of risk and protected factors, and evaluate the prevention of harmful outcomes, correct? So again, we'll be evaluating changes in result outcomes through proxy indicators, and we will be able to see whether the risk factors have been mitigated and the protected factors have been strengthened, therefore theoretically reducing the likelihood of the harmful outcome occurring. And the last point, number 3 in there, it's about sharing learnings on prevention effectiveness. So basically, we are also making efforts to analyze and share and collect all this information and disseminate it, like in events like today, in webinars, and also other type of products that we're going to be releasing soon, so that what we're learning in terms of effectiveness, it can also be shared broader with other stakeholders. And with now, I think I will give the floor now to my colleague Malish from the South Sudan office, and he will tell you more concrete examples on how we actually we undertook monitoring and evaluation during the pilot in South Sudan. So over to you, Malish.
Thank you so much, Monica. Hi, everyone. This is Malish Clement from South Sudan. I'll be taking you through some of the slides, and then my colleague Lomena Albino will continue with the M&A part. Thank you so much. So basically in South Sudan, we piloted this project, and this happened in Yei, in South Sudan. That's part of Central Equatoria State. So basically, as already stated, our main goal is to prevent child marriage and child labor in targeted locations through improving access to livelihoods and quality education. So we had like 2 major outcomes that we worked for. So one of the outcomes was to improve access to livelihoods opportunities for households in targeted areas. And then the other outcome is also increase the enrollment and the retention in quality educational opportunities. So it's like 2 sectors in one project. So key activities that we did under outcome 1 on livelihoods is provision of conditional CASA assistance. It is conditional because we attached some parenting session to it. That's why we called it conditional CASA assistance. So before you get the money, you have to go through parenting session. Then the other activity we did was also formation of the village savings and loan association groups. Through that, we were also able to train them, and then also we gave them some kind of startup capital to be able to do some kind of workshop with stakeholders to also be able to map the existing livelihood services around, and also be able to carry out some kind of awareness or to disseminate to the communities about the existence of those livelihood services. While under education outcome 2, we basically did enrollment campaigns, and we also trained some teachers, stakeholders, and PTS on participatory teaching methodologies, including provision of learning materials and also recreational materials. So all these were aimed at, trying to respond to the needs on the ground. So also to remind us that this program was implemented in an integrated manner, multi-sectoral manner, where we also collaborated with other agencies that are engaged in education, as well as FSL activities. And we also worked with other community leaders, as well as line ministries like education, Department of Gender, Child, and Social Welfare, community leaders. So to ensure that what we were doing was actually coordinated to be able to respond, address the needs in an effective manner. And it also worked with a range of actors. Apart from the government, we also worked with the other local and international organizations in trying to ensure that what we were doing was reaching the needy. Next slide. So how we monitored the primary prevention pilot project was in these 3 areas that you can see here. So we monitored potential changes in risk and the protective factors during the time of implementation, and we were able to get the changes through the mid-term risk and the protective factors ranking, because at the beginning, before the project, we did that, and then also in the middle, we also did that ranking to try to see what were the changes in terms of the risk and the protective factors that were mentioned at the beginning, and then also in the middle, and then also at the end. So that's how we tried to monitor those changes, and then also be able to track the trends. Like in the ranking at the beginning, how was it? In the middle, has the ranking changed? Maybe from number 1, something moved to 2 or moved to the last. So we're trying to track those changes to be able to inform the quality and the relevance of this intervention during the implementation. Also, we also tried to adapt the program to other changes that came in the middle. For example, somewhere in the middle, we realized that other risk factors came in, like we experienced issues to do with abductions, youth fleeing the village areas, coming to the town for safety purposes. So we actually also tried to look into those to try to see how this primary prevention could also be able to adapt to some of the changes, especially the needs that were coming up. And then we also did some post-distribution monitoring. Of course, after giving some cash, we had to get to the communities through a PDM assessment to try to see what changes were being noted as far as the intervention was concerned. So the PDM was also an important approach that we used, and it was able to give us or inform us of the effectiveness of this framework. And then the other method also we used to monitor the prevention program was through regular field visits and observations. So we did meetings with the beneficiaries themselves, and even also the community leaders. We tried to talk to them to gauge how effective the program was. So through the meetings, it was also one of the ways, checking on progress, challenges that were faced. For example, we know that our country, South Sudan, in terms of the status of the economy, it's not doing well. And those who were given like some kind of VSLA grants to be able to start up some business, in the course of doing that business, because of daily changes in prices of goods and services due to inflation, this was one of the things that came up. And in the course of time, of course, as we did the visits, we were also able to support those groups with ideas on what they should be able to do, so that they also catch up with the rates, the changes in the economy. So those were some of the things we also tried to find out and see also how to support them. So those family visits were also very important in that regard. We also visited schools to try to check the level of participation of learners in activities, in learning, before the training and after the training. So it was one of the methods we used to be able to monitor this. And then also monitoring enrollment as well as attendance to see how many registered before the intervention and how many registered after the intervention. So those were approaches we used to monitor this prevention program. Next slide. So as mentioned, one of the key ways also we did monitoring and evaluation was through the baseline and end line. Before at the beginning of the project, we did a baseline survey, and then at the end, we also did a baseline assessment, and we also did baseline end-line risk and protective factors exercise to try to see the changes in terms of risk factors and protective factors before the implementation, and also in the course of implementation and after the implementation. So all this, the baseline and the end-line assessments also gave us some lessons on the effectiveness of this this framework. And we also tried to look at effectiveness, the relevance, the usability of this framework. As all of us might know previously or initially, our response in child protection has been more of level 2 or level 3 in terms of case management, coming to respond when harm has already happened. But now through this primary prevention, we actually also learned that it was the best way to go, because now when we are able to respond before harm happens, this means that we will be able to respond with limited resources than waiting to respond when harm has happened. It requires a lot of resources for us to respond. And I think in the course of this, I'll also be able to show you some success story that came as a result of this approach, without which we don't know what might have happened. But now with this intervention, we were able to rescue a situation that would have gone bad if we didn't come with this primary prevention approach. So from our side, as far as South Sudan is concerned, and for those of us who participated in this intervention, in this pilot program, we see that it was actually the best way to go, and we have also learned a lot out of it. Next slide.
Malish, would you mind if I just say a word with related to the previous slide? Sorry to interrupt you. Okay, so just to complement what Malish is saying, so the first bullet point that you have in there, it's about actually how the methodology we use to evaluate the results level outcomes of the program. The second one, it's not so much to do with actually evaluating how the pilot program went, but more like to evaluate, to look at how the framework, remember that tool that Michelle has introduced to you before, how good it was into actually informing how the primary prevention pilot was implemented on the field. And also basically, again, with the same intention of understanding whether if the framework was good, it wasn't good, it was practical enough, did it have enough examples, was user-friendly or not, again, with the intention always to keep improving the resources and basically make them better for practitioners in the field. So this one, it's a little bit like it doesn't have to be so much with the actual pilots, but with how we use the framework. And for that, we use a qualitative approach to allow for in-depth analysis. And we interview 10 people that have been directly in contact with implementing or like using the framework. So colleagues like Malish himself, like colleagues that have implemented the framework in the ground in their respective locations, but also other global advisors and other people that had actually used the framework. So this is a different layer of evaluation, just to clarify that. Thank you, Malish. Please carry on.
Thank you so much, Monica, for the supplement. The next slide. Yeah, so as far as the baseline and endline assessments are concerned, basically our main purpose of this is to assess and measure the extent to which the project has been successful in addressing the root causes, or either a decrease in risk factors or increase in protective factors and preventing occurrence of child marriage and child labor. So that was basically our key main purpose of doing the baselines and assessments, to inform us of how effective this program has been. And of course, we collected samples, we interviewed people, we did interviews, we did focus group discussions. So through those methodologies, we were able to get qualitative information using the tools, both the quantitative tools and the qualitative tools that were used. And through that, it was also able to inform the tools that we used. Was able to inform the analysis of the results. That after here, I think our meal coordinator will also be able to look at it. Next slide. Yes. So basically, as part of the analysis that came from the baseline and endline assessments, you can see from here that at the baselines we had some values, and at the endline we also had some values. So this tells us that this framework actually also works, because if you look at the first item here, percentage of boys and the girls reporting children get married before the age of 18 years. So at baseline, at baseline it was 100%, and at endline it reduced to 50%. So it is an indicator that in the course of the intervention, some kind of awareness, consciousness, level of knowledge was gained, and people now understood it, and they were able to give us the results through this measurement. So it's also important to highlight that what we are saying or reporting now or discussing now is also, it has been supplemented by the efforts of other partners. For example, we have organizations that are in EA, and they have been also engaged in similar kind of interventions. And also before this approach, this framework came, Plan International has also been active in this part of the region. And the only difference is that we were responding to all already harm that already happened. But now this approach came with a different, with a different way. This framework came with a different approach of trying to prevent harm before it could happen. And we have also learned, as I said earlier on, we have learned a lot out of it, because when we respond before harm happens, actually, when we respond timely, definitely.
I can explain a bit, especially with the marginal change in terms of the percentages. Like, what does it mean? Because basically this does not. Are you able to get me?
Yes. Yes, please.
Hello?
Yes,
Okay.
yes.
Okay.
We can hear.
So, so I was saying, yes, the marginal change does not signify that the entire county, Yei County, but basically this is in reference to the beneficiaries we have supported, because we had to sample those that we supported with the intervention. Does not necessarily mean the entire county. So when you see the change from baseline and end line, these are specifically the beneficiaries that we have supported. I needed to make that clear. Malish, welcome back.
Thank you so much. My internet had issues. So, yes, thank you for the supplement. Yes, basically, this pilot took place in only Yei town, and it also didn't cover the entire Yei town. Only 2 areas were selected for this pilot. So the information we are presenting here relates to those specific locations where the intervention was done, and information was also collected from those same locations. Yes, so what we are presenting is location specific, so it doesn't cover the entire even Yei town. So meaning that in future, should opportunities or funding be available, definitely this needs to be expanded to a larger area, so that when we are also evaluating, then we can also be able to actually evaluate it properly with a bigger number of beneficiaries targeted. Next slide. Yes, so in this slide, I just want to share a success story. And this success story involves Betty and Rebecca. So you can see the mother is there, and the other daughter is here on the photo. So before the intervention, the mother was actually in financial difficulties, and life was difficult. Of course, you know, once you are a displaced person, you have lost your livelihoods. You know what it means to be in such a context. So being displaced and you are a single mother, you don't have a source of livelihoods. So this situation made the mother to arrange with someone for Betty to be able to engage in a child labor, in some kind of work to be able to supplement the family income or family livelihoods. But as this intervention came and the household was selected for this support, of course, after getting the support, the mother to this little girl was able to engage in some kind of business. And when that support came, the arrangement that the mother had with some other vendor in market for this young girl to be able to do some work ended, because now the mother got empowered, the mother got the support she needed so that she could be able to work on her own and be able to support her children. And when this support came, of course, the girl was enrolled to school, and the mother also became a vendor in the market. So that ended the child labor for this girl. So that's why I was saying, if this framework was not to come, I don't know what was going to happen to this girl. Because being in the market, you know, there are a lot of things. There are a lot of risks around the market. So it means even this girl was going to end up getting married early. But with this intervention, something has changed the lifestyle of this girl and the lifestyle of this mother. So if continued and expanded, there are many, in hundreds, who could also be able to change the lives of their children in a similar manner. So this is just a success story that I want to share in brief. But of course, the narrative is there. that all of us can be able to access. And this is what I want to conclude with. So at this moment, if Monica, if there's anything or not, and then I can pass the ball to Lomena. Over to you, Monica.
Yeah, no, that's completely fine. Thank you so much, Malish, for sharing this story. And just to mention that, I mean, he's already explained it very well, but it actually was a really interesting story in that this girl, as Malish was saying, had started working and then thanks to the support of like the preventative approach, that integrated approach with the livelihood support and the parenting, they actually managed to find a way of mitigating that, but like said, in their own business, so that the girl didn't have to go to work anymore to support her mother, and then was enrolled back in a school. And the quote that, because I was there when that interview happened in JA, and the quote that stuck to me was when she was looking at my eyes and saying, you know what, like before I used to go to bed and I couldn't sleep with all these worries in my mind, but now I do sleep like a baby, knowing that, you know, I have my little business and I can provide for my daughters. So just to say that it was actually a really rewarding story. And sorry to speak too much. Without further ado, I give the floor to Lomena, that's gonna take us through some more interesting things. Lomena, over to you.
Oh, okay. Thank you so much, Malish and Monica. You know, it's really great. It feels like I'm still in here as we are part of that, you know, to see the happening to meet your JD. But if you get to go to the population and then meet the smiles, the changes you're able to bring to them, it's really great, because I was also, you know, in such a context one time. Okay, getting to my slides. You know, we have talked of risks and protective factors. So as part of the minimum humanitarian standards, it demands and requests for community participation, that you don't just get up and say, okay, possibly these are the risks in such a location, or possibly this can be the preventive measures. No, this was not the approach taken. What happened was, before the project could start, more like, say, a baseline situational analysis, a needs assessment comprehensively was conducted in consultation with the boys, girls, men, and women, taking into consideration inclusivity as well as those with disability, to ensure that we map out in the specific community, what do they think are the risks within the community, and what do they think are the protective measures that, when implemented, can really save a lot of girls and boys being, you know, to experience the risks. So the exercise was conducted through a focus group discussion. And most importantly, there was a ranking, which I'll go into the scatter plot. I know it doesn't really, you can't read exactly what is there, but I need to explain to you what it means. So we'll look into the risk into details. So when the focus groups were discussed, was discussed with boys, girls, men, and women, boys were to identify the risk factors, protective factors. Then, to be able to triangulate data, for data triangulation, to be able to see that factor A is cross-cutting across all the focus group discussion, we also had to do that with the boys, girls, men, and women. Then provide ranking of 1 up to 5. So in actual sense, what I'm trying to say is, this is a scatter plot, which is automated. In a community, you can have the impact and then feasibility. If a risk factor like, say, forced marriage might not be, you know, frequent. The level of happening might not be so frequent, but if it happens, the impact is extremely what? Very, very high. So that is what we're looking at here. So when you look at this scatter plot, the vertical axis looks at the impact. If a risk occurs, or if there's a factor, a preventive factor that is likely to happen, and we don't prevent, if it happens, what is the impact on the life of the individual? And then down here, the vertical axis, we are basically looking at the possibility or feasibility of it happening. So down here, if you look at the horizontal bits, all these factors that are below the first box, it means the factor that is here, it is having a low likelihood of happening. And then even if it happens, there's what? There's less impact, low impact level. Then the second box down, during the discussions, it was also realized that the factors that falls here have high possibility of happening. The frequency is high, but even if it happens, there is low what? Impact. The impact is not as great as that of forced marriage, you know. And then now our focus is up. All the factors that has high impact as per the ratings. Actually, during the FGD, the tool, they had to rate which one is likely to happen and which one has high impact according to them. So then now in the automated plot, once you plot, you'll be able to appear. This is automated scatter plot. So when you go up, the first factors onto your left, these are factors that are highly possible, can happen, but with also high impact. Yeah, it can happen less frequently than with the high impact. So as per the prevention, so all the factors up here, the ones that can happen frequently and again having high impact, this was our area of focus, which means when you look at here, all the intervention, all the approaches of looking at VSLA, looking at, cash support, looking at positive parenting, it was these factors that are having high feasibility and again, high impact. The ones that are having low feasibility and low impact were left out. We look at the specific risk and preventive factors, and also comparison how it was in 2030 before they start and after they start. So I think we just wanted us to go through that to understand how was the choice of intervention made. It was not just like in the office and then you see it, say, let's go do this. No, this was the approach used, a community participation. Next slide. Yes. So now, before the start of the project, during the focus group discussions, this was with all the boys, girls, men, women. But here, what is happening? We have picked out across all the group, triangulated properly, what are the key risk factors for child labor. Then later on, we'll go into the second factor. So in 2013, 2023, that is before the intervention, what was coming out? We get to realize that poverty, stroke economic hardship, was one of the leading factor that pushes, boys and girls into protection concerns. So it was the biggest risk factor. Then the second one was displacement due to conflict. But let's see how the changes. I want us to compare, like in 2023 before and then 2024. What are the changes? Then we can see that probably there are changes here and there. So in 2023, the ranking was that poverty was the first factor that forces children to go into child labor. Of which the same discussion was also made when you see in 2024, they still mentioned poverty as still the main factor that pushes children into what? A child labor, which is a risk factor for that. So a lot has not changed there because probably, the approach really holistically would not really evaluate. It's not a poverty elevation program at a national level, but at household level, though we'll still be able to discuss more to that. And then when you look at in 2023, in comparison, we had also displacement due to conflict being the second risk factor. Yet in 2024, when we went for the same discussion, this time around, it was identified as the least displacement due to conflict. So this was basically at a top level, you know, with the stability, return of people who are in the camp, refugees settling in, then that's why there is that drop in it. Then when you look at the third factor in 2023 as the risk, you have lack of education. That is specifically a school, lack of school materials. So when you look at 2024, lack of educational support came into fourth. So this is where now we can use the proxy indicators to say, okay, now lack of school materials is no longer a risk, because most girls are already, boys and girls are enrolled into schools, because you don't have time to go into forced labor, child labor, when you're busy in school. And then when we look at the fourth factor, that is lack of access to quality basic needs. So this was only mentioned in 2024 and 2023, but 2024 it did not resurface. Then lack of parental guidance or poor communication with the parents. This was mentioned in 2023, but after the intervention, as you see here, we have it as lack of parental guidance as well. It went a bit high as one of the main risks identified. So we will need to then dig deeper. I think we'll need further analysis into this to see the changes despite the positive parenting, the awareness sessions. Then the last one is discrimination within family and cultural practices of inequality, that is girls and other siblings within the family. So this was not identified again in 2024. But as a part of monitoring and tracking changes in risks, what are the new risk factors that did not appear in 2023 but appeared in 2024? So if you look here carefully, you get to realize that peer pressure in 2023 there was nothing about peer pressure, but if you see later on that peer pressure is another risk factor, probably influencing fellow colleagues into habits that are not right. Then separation was also mentioned, being an orphan or separated from caregivers. This was identified as a new risk. So this is part of the monitoring to compare what were the risks in 2024 and then 2023 and then 2023 and 2024, and link it directly to the support we're providing. Though when you read throughout during like the narrative and the reports, we do not say it's totally only the project, because the community there, the number of organizations, there are a lot of structure. So we are contributing to the bigger change in the community. Next slide, please. Yes, so that was about child marriage. The same exercise in the tools, we also had questions around child marriage. That is the protective factors, that if we put, what can we put in place to ensure that child marriage does not occur or is prevented within the community. So with the different focus groups in 2023, before the project, it was identified that access to basic needs or cash support, if it is provided, then a lot of cases of child marriage will be reduced within the community, of which, if we have been following the presentation from Malish, I think this is positively related to the case story given. You get to realize that there was a child marriage. This child, if the parent was not supported to send her to school, probably it will be the case. So child marriage was identified as fast in 2020. 2023 as provision of access rather to support, specifically cash. Then when you come to 2024, you realize that cash is no longer the first preference. 2024, they have gone into setting and enforcing laws by government. And actually, Monica and Malish, if you remember, there was one of the traditional chief. Machashi was using the local language, but he was really emphasizing that organizations can come here, you conduct awareness, you train people. But if the government does not come and put laws in place to punish perpetrators, will really realize something so small. So you can see now the changes, you know, they are being part of the process. They identify this. And actually during the discussion, there was, you know, a debate, discussion. They say, no, to me, this is fast. To me, this is not. So it is coming from them, really. It's community owned. And then in 2023, they said positive peer influence. If they start positive peer influence within groups, it will reduce child marriage within the community. And then in 2024, this was also not identified. Then when you go into the third factor, in 2023, you realize that positive parenting and guidance, that if this is identified and well done, it can contribute to protecting girls from child marriage. And then when you compare in 2024, when we went back again to do it, it still remained highly important and recommendable that positive parenting is really important for parents to ensure that they know how to go around with parenting their children. Then again, we have there should be no discrimination or equal treatment at household level, which was the fourth factor before the project. Then when you come into after the end of the project, it was not identified. They had other priorities. So if you see here, the fourth factor in 2024 was conducting awareness on negative consequences of child marriage. Positive parenting remained, and then cultural harmful factors, which goes hand in hand with the awareness. Then the fifth factor before the project was enhancing access to education or vocational training program. So the first one up there is basically basic needs, but this other one is specifically to education. So once it's enhanced, they're saying that it will prevent a lot of cases of child marriage within the community. Though if you also compare, they said it's still relevant. It was one of the factors that was identified that we need to, you know, continue to have access to school and keeping girls. Specifically, they mentioned actually girls to make sure that they are kept in school, which will reduce cases of child marriage. Then we have social protection access. These were the last mentioned. Stability, conflict. So these ones came actually last because it was argued that it is not the role of the organization to provide stability at the county level. It's just contributing as part of advocacy. Next slide, please. Yes. So the last section here, as I wrap up, is lessons learned on monitoring and evaluation. What could we do differently going forward? Is that in the multi-year programming, periodically monitor changing the risk and protective factors is important, as because a factor might be you know, highly prevalent and with high impact, but it changes anytime. Then ensure flexibility to adjust changes. That is what I've talked about. Then evaluate changes in result level, that is outcome of harmful through inline evaluations and assessment. I think part of that has been reflected in the evaluation findings. Then we have coordinate efforts across multi-sectoral teams. That is, in terms of the partners that are on ground, please, it will be good to coordinate with them to see where they're working and what they're doing. Then what was proposed by the field teams during this exercise was that what should come into the new M&E addendum, or as going forward, we need guidance on developing theory of change, so that we have a holistic theory of change into this, rather than just only the logical framework, but also a holistic theory of change. Then we have sample results of log frames within indicative activities and outcome level indicators will also help a lot. Then we need prevention adaptive post-distribution tools to be able to avail, so that we update the ones that we're having. Otherwise, I think this is my last slide. Thank you so much. Over to you, Monica.
Thank you so much, Lomena, and I love the way that you actually really dissected and took through us through all the components, so we could see the changes in 2023 and 2024. And just to say in the previous slide, just to say that the suggestions and the ideas that we collected from the learning and close out monitoring workshop that we had in country are being this is what I was just explaining to you, that this is how we're collecting the information to be able to articulate the necessary changes. So a lot of these things, like guidance on developing the theory of change and the results sample in the sample results framework, these are two of the things that are already being incorporated into the revision of the framework, as well as the M&E addendum. We have to see about the PDM tools, but this is something that, just to say that all these learnings are being taken into consideration. And just with that, and thank you both for a wonderful presentation. We move to the next slide and the next section of the session today, which is actually your Q&A. So, yeah.
Yes, Monica, maybe to highlight something, maybe if you can go back to the other previous slide.
Oh, okay.
Yeah.
Yes.
Yes, I'm just adding to the other point of ensuring program flexibility to adjust to changes. This is really very important because the context of South Sudan is in such a way that situation changes every day, or now and then. So once a program is flexible and is able to absorb other emerging trends, and then that would make it very, very relevant. One of the lessons I have, or one of the things I have seen with the ECHO project is they have what they call crisis modifier. So in a crisis modifier, it means you can be able to do some kind of changes within a project that is already in existence or is being implemented. You can be able to do some changes within when the situation requires. So once we are able to have a program like this, especially for a prevention framework like this, I know it is more of, it works well in a development context, but then if it is flexible enough, it will also be able to address some of the emerging needs that come in the course of time. And by so doing, this makes the framework very relevant in addressing some of the issues that may have not been conceived at the point of project or program design. So this is something I also wanted to re-emphasize. Thank you so much, and over.
Thank you, Malish. That's wonderful puntualization. And also just to say that, and this is something that we'll be discussing, that this program has been to pilot, right? So it's been short in duration, and that has posed a limitation, but ideally, excuse me, ideally would be aiming to have like multi-year funding programs, so that we are able to actually work on those premises, and also, as you are saying, like be able to be responsive and adjusting to changes that are happening, that recent protective factors that are emerging and changing as we go along to adjust our program. Perfect. Just thank you for that remark. And then now, yeah, we open the floor to the listeners, to the participants. Please unmute, don't be shy, ask questions as much as you want. We're here to reply to them.
So I do just want to flag that we have one question from Emily in the chat asking if tools like the ranking exercise are available with the toolkit. And so I'm happy to take that question.
Please,
and
yeah.
Yes, so the resource that we use to guide the risk and protective factor ranking exercise, including the actual exercise itself, as well as then the analysis interpretation of results, are available on the Alliance website. It's under, I can share the link in the chat, but it's the risk and protective factor ranking guide. These are also under review as part of the framework revisions, because one of the things we found through piloting was that the resources as they currently are a little complex and complicated for and impractical for use at field level. They were just a little too complicated, and we found that we did quite a bit of work to just make them more usable and easy to understand. So those resources are under revision currently. Thank you for sharing, Monica. But they are currently available on the Alliance website. Monica shared the link in the chat, and the revised versions will be available in the near future. So just to answer that question. And then I don't know if anybody else has any questions that have come up.
Thank you, Michelle.
Yes, I just wanted to share my experience for those who are still asking for the tools as they will go collect the data, get back. So I would advise that from the start, you define the ranking clearly. As you collect this, you will not be able to just write, and then without the ranking, it will be difficult for you to plot it into the scatter plot graph. And once you, based on the number of factors you're considering, you should be able to readjust the vertical and the correct the horizontal axis. Otherwise, it will not be able to pick out all your risk and protective factors to appear the way it is. So this is important because we had to readjust here and there. We had the back and forth with Monica. Thank you so much.
Thank you, Lomena, for that. And also just to say that, of course, like as practitioners, like if you're operating in any given context, we, as we mentioned a few times over the presentation today, that we are revising the framework to make it more accessible, stronger, and better. But obviously, the application in real terms of the framework will also depend very much on your particular context. So what we're telling you, it's just, or what not telling you, but what's in the framework is like guidance on what we have tested that is the best approach to that it could work, but also it will take some work from the field teams in the location where it has to be implemented to actually look at the different issues and the different processes. And this would, for example, involve Michelle and I were just talking about it the other day in a different meeting about like being very able to identify who are the relevant actors that might be operating in the place where you're going to be implementing. So this being relevant stakeholders, so that could be government officials, other NGOs, organizations, service providers operating, communities themselves, and being able to, and this is something Malish, remember that we also discussed during our monitoring visits, how we should be able to do a mapping of different actors and understanding how we could engage with them in a way that it can be strategically benefiting the program. So just to say that the guidance is there and we have lots of resources, but it's also it would be flexible enough to allow for contextualization. So should you have to use it in your different and relevant places.
Yes, just to add also on what Monica said, indeed, engaging the community leaders or the wider stakeholders in such a program is very critical because at the beginning, when we started, we actually encountered some kind of challenges at first, but with the engagement of community leaders, having explained to them about the program and the selection criteria and all this and that, it put to rest some of the complaints that came up. So in such a program where you are going to respond to a community where harm has not happened, and you now just like want to prevent something bad from happening, other people may look at it from a different angle, thinking that maybe you are like discriminating. So working with stakeholders is key. And once the stakeholders understand the program and they now own it, they will actually also be able to be on your side and support in the process of implementation. And where communities do not understand it well, they will actually be the right persons to be able to say, okay, this is how this program works. So this program requires good collaboration with the key stakeholders, people at the level of the government, the line ministries, while also engaging strongly with the community leaders like the chiefs, area leaders. That is very, very critical. And it is one of the things that made us actually to move forward. Without them, things would have been complicated. So community engagement is very important. Thank you.
Thank you, Mitch, for that reflection. And also it alludes to also one of the lessons that we have been learning, that it's just like a collective approach, collective effort. We cannot, one organization alone cannot work in prevention, primary prevention. It has to be a compounding efforts. If there are not any other questions, which I don't believe they are, I might actually wrap up this section, and I might actually give the floor to Michelle, who is going to be taking us through a few other very interesting initiatives that are happening at the moment in terms of primary prevention. So if that's all right, Michelle, please, over to you.
All right, great. And if we can have the PowerPoint back up, that would be wonderful.
Yes.
So as Monica mentioned, we have several other exciting pieces of work ongoing with the prevention initiative. If you could go to the next slide, please. So we are currently in the process of revising the primary prevention framework and its associated annexes. This is actually currently in what we call red flag review, meaning it is the final round of review for the primary prevention framework and several of the annexes. We are hoping to wrap up this piece of work early 2025. We are also in the process of developing the monitoring and evaluation addendum to the primary prevention framework. We are nearly completed with the first draft of this, which has really been informed by the pilots and by our lessons learned. And that will be ready to be shared with the advisory group early next week. So that will also be coming out early next year. We also have an ongoing clinic series, which is more of a learning opportunity where we delve a bit more deeply into different aspects of primary prevention programming and are able to then have more collaborative conversations and back and forth on these topics. So we actually had our first clinic session in the series yesterday. So thank you to those of you who have come to both. Our next session will be next Wednesday. It'll be focusing on the theory of change and how we developed that and how to develop theories of change for primary prevention programming. And that one's going to be quite interactive, so I think it'd be really worth joining. If you have any other questions for us or on the prevention initiative, you can email the primary prevention focal point. Her name is Pippa Smith at prevention@alliancecpha.org. Thank you all so much. Monica, you're on mute.
You would have think that that mistake you wouldn't do anymore, right? Like after so much talking online. Sorry. Just to reactivate my. Can you hear me?
Yes.
Oh, okay. So my computer is telling me to reactivate my audio, but that's just nonsense. Anyway, just this is just for me to say thank you to everyone that joined today. Thank you for following with like comments and questions on the chat. I hope you had a good time. We definitely, the panelists, I think, speak for the four of us that we did actually had a good time presenting to you today. As we mentioned before, this will be recorded and placed on the Alliance website, so you can actually see the recordings of the whole series, and then we will make sure that we'll advertise the next one in early, sometime early next year in January, so that you are able also to make some times and enroll for that. And nothing else from my side, just to say thank you and to wish you all good afternoons or mornings, depending on where you are. And thanks for, sorry, well, just the last thing, to thanks the panelists, both Lorena, Malish, and Michelle, and also to thanks Pedro. That has been fantastic to make sure that the session was running smoothly, technically wise.
Thank you, everyone, and
Thank
have
you.
a great day.
Bye-bye.